what would you like seen from both the research aspects of this response and the public health aspects of this response? What should we be doing as a country, as a global public health community, that we could be doing better currently in the monkeypox response?
Well, I have one comment. I mean, I have been, through my role as the surveillance lead for GeoSentinel, I've been communicating with sites in Europe, and we've developed a protocol for supplemental data collection on all the monkeypox cases seen at our sites. I already have a non-research determination, have developed an electronic database, sent that to all the sites over a week ago. And some of the sites are writing saying, you know, this is like the fourth different project, different organization is asking us to collect data, and they're overlapping. So there's a lack of coordination among, you know, I say between the US and Europe, but even within Europe. I mean, they mentioned, you know, the Spanish Society of Dermatology and the Spanish Society of this, infectious disease. I mean, there's all these different organizations that are trying to collect data concurrently, and there's no centralized coordination of those efforts.
What would you like seen done, both in response and in research, I guess, response to this, John?
Yeah, so I think one of the things that is obvious about this outbreak is that we have kind of been waiting for it to happen. Maybe we didn't want it to happen, but there have been introductions time and time again for decades now. So the idea that this will happen again is not really just it is unlikely to happen. It will continue to happen. And I think there has been a sense that all pox viruses are a solved problem. And this is a wake-up call that it is not a solved problem. There are real risks to treating pox viruses as not very important. So I think having an increased understanding that monkeypox could show up and in various different ways, that other pox viruses like cowpox could do the same is really important. I think I'm super excited that we already have vaccines. We already have what could be first-line therapies. I would be really excited if we also moved to develop second-line therapies with the understanding that if these viruses continue to be introduced and reintroduced, it would be nice to have a large pharmacopoeia to protect against any serious disease.
Yeah, and I would imagine you might want, David, from your perspective, more data on the efficacy of the current medical treatments as well. Now is our time, and people don't usually get it that it's the catch-22 is that you can have promising drugs, but to prove their efficacy, you need to wait until an outbreak. So you have people who are at risk, so you can actually deploy it. Are there other things that you'd like to see in the research response?
Well, yeah, I think it would be helpful to learn more about transmission and to understand, you know, as I mentioned, asymptomatic transmission, does that happen? Does the virus get into certain body fluids like, you know, semen or sperm, which we learned a lot about Zika? It could be transmitted sexually. And we have no idea whether that's the case, excuse me, with monkeypox. I think it also will be helpful to see with all the healthcare workers that are managing patients with monkeypox, if they're using effective protective equipment, will there be any breakthrough infections? That alone is just very simple, but really good knowledge, because I think that we're going to find the answer is no, and that if we're using the right precautions, we can easily prevent people from healthcare workers from being infected, and that'll be very reassuring.
Yeah, I want to go back to a point of irony on something that John mentioned. You know, we've known about this disease for a really long time, and it's been causing outbreaks in endemic diseases in endemic countries for a really long time. The question that our viewers would probably be asking is, if we had an effective vaccine, we have all these treatments, and we knew that this was a threat, why didn't we act to try to make these more controllable outbreaks? Or why didn't we use the opportunity to partner with our global partners in countries where the monkeypox is endemic to do the research? I guess that is another example of where we've failed, is in North-South collaborations to improve our knowledge of these pathogens and helping our global community as well. So go ahead, David.
I was just saying, I mean, this is, I would put this in the category of a neglected tropical disease. I mean, there's just not much money that's been put into it. And it's been, if you look at data from the last decade in the Democratic Republic of the Congo in particular, there are many more cases, year by year. So this has been expanding there. And that's probably because of the loss of immunity from smallpox vaccination, as we have a larger and larger, younger portion of the population who have not received that vaccine. And then cases have also been steadily rising in Nigeria, which is one of the most densely populated countries in Africa. So, I think we need to be thinking now about trying to understand more about the disease epidemiology, disease transmission, and treatment in these places, because those lessons learned can be applicable to the United States.
Very good point. And I think also expanding on what you said about the smallpox vaccine and the phenomenon of monkeypox cases. So what people should know is that we stopped vaccinating for smallpox when we eradicated the disease. By the way, the only, I think, so far the disease that we've eradicated. There might be others on the way. We're close. And when we did that, we stopped vaccinating against smallpox, and the smallpox vaccine, I believe, has cross protections against monkeypox. And the thought is one of the reasons why you're seeing an increased number of cases in areas where this is endemic is because, as David mentioned, a loss of immunity. So let me